Hi, my name is Morgan, and I'm a future aesthetic nurse injector. So, what is aesthetic nursing or cosmetic nursing? It is a growing niche field of medicine. Aesthetic or cosmetic nurses are those who are providing a service to patients. So, they're performing procedures like neuromodulators, which is like Botox, dermal fillers like Juvederm. They are using different modalities of energy, such as laser treatments, they are using chemical treatments. Most of these nurses are found in med spas, private practice, and predominantly dermatology and plastic surgery offices. These offices are private practice most of the time, so aesthetic nurses are not dealing with insurance. So, a little bit about my past. This picture is when I did not wear sunscreen, and it hurts. Growing up, I had warts on my knees and elbows, so I wasn't always confident in my skin. I was very insecure at one point. I was actually wearing long sleeve and long pants, even in the summer in North Carolina, swimming in the lake with long sleeve and long pants because of my skin insecurities. My mom actually has only worn makeup on her wedding day, so she has not been very supportive on that side of how I got here. I think that's probably what pushed me into this direction. And my dad always hated his job and told me that if you do what you love, then you'll never work a day in your life. So I have valued happiness over money for a very long time, and that's why I'm pursuing my passion. It was in 2006 when I had my first laser treatment, and this was to actually get rid of my warts. So I had done everything prior to that laser treatment, and it actually worked. I was ecstatic. I was finally confident in my own skin. With that newfound confidence, it just continued to grow throughout my life. I wanted to give that confidence to others. So, for my personal project, whenever I was in high school, I actually conducted an event that about 40 different girls donated their hair, and then about 10 to 15, I think close to 15 people shaved their heads with me. This was all in an effort to show cancer patients that you don't need hair to be beautiful, that beauty, true beauty, comes from within. So during my undergrad, I shadowed with a dermatologist at MD Laser Studio. I thought that dermatology was more about the warts, those types of things. I soon found out that there was another side of dermatology that was even more fun than just warts. One story that sticks with me about an aesthetic patient from this practice was a patient who she was a previous drug user, alcohol abuser. She had finally gotten clean. She was clean for 5 years. She was saving up her money. She aesthetically did not feel like herself when she saw herself in the mirror. So obviously drugs, alcohol are going to age your skin, and she just did not feel like she was clean. She felt like when everyone looked at her, all they saw were the mistakes that she had made in the past, and she wanted basically a fresh start, so a new face. So fast forward to where I am now. I am working underneath my dream mentor. She is the most caring and patient mentor, not to mention a very talented and incredible injector. So I am having a great time where I am now. So the first step into becoming an aesthetic nurse is obviously becoming a nurse. So you do have to have a license to inject neuromodulators and filler. Not for all laser modalities, but other higher modalities that require more downtime, wound healing, those modalities require a nurse or provider. So with aesthetic nursing, the training is very in-depth, but it's actually more product-based. So there are different types of courses and seminars that you can do that are just on aesthetics as a whole, more well-rounded, but most training is going to be product-based. So when I say that, I mean that when you go to inject Botox, you will be trained by someone who specializes in injecting Botox. When you go to inject Juvederm, which is a lip filler, Juvederm Ultra Plus, something like that, you will be trained by either an MD, a nurse practitioner, a PA, or another nurse who specializes just in that product because all of the products are different. The training is specific to what the aesthetic nurse wants to gain more knowledge in. The hiring process is very different for an aesthetic nurse compared to another nurse. The aesthetic nurse, for their resume, are required to have a picture. The aesthetic nurse is also required to have a portfolio. So unlike a resume, the aesthetic nurse's resume is more about their portfolio work of what they have done in the past. So that would be before and after pictures of 10 people's lips. So the aesthetic nurse, just like every nurse, is going to be performing an assessment. And for them, it's more of a focused assessment. So the nurse is going to ask the patient to perform movements with their face, so such as surprised, angry, funny lines, just to see what is the patient's movement before they inject. Big smile to see crows. These movements are showing the nurse if the lines are static or dynamic. Static means that the lines are staying there after the movement. Dynamic means that the lines, like on my nose, they're only forming whenever I am performing the movement. What else does an aesthetic nurse do? And a majority of their day is going to be performing procedures. So the aesthetic nurse is going to be in with one patient at a time to assess and perform the procedure. This procedure is based off of what the nurse is assessing and then what is the patient's outcome that they are expecting. That procedure, sometimes people will come in thinking, oh, I just want to do lip filler, when the aesthetic nurse is showing them that their outcome of what they want may not be achievable with their facial structure. So the aesthetic nurse's job is to meet in the middle with the patient to give them the best desired outcome with their procedure, even if it's not what the patient originally thought that they would be doing. Education is a huge part of an aesthetic nurse's job. So prior to performing a procedure or prior to even performing an assessment, the aesthetic nurse needs to be knowing what to look for. So a lot of aesthetic nurses will go through a cadaver course before ever injecting. A cadaver course is just as it sounds. So they are cadaver bodies. The skin of the face is removed, so only the muscle of the face is showing. So the aesthetic nurse can see exactly what muscles move as you freeze them, which ones are moving in relation to each other. And that is an awesome way for an aesthetic nurse to practice injecting and understanding facial anatomy before ever performing a procedure on a real patient. Another part of education is educating the patient. So with procedures, there are follow-ups and understanding how do I take care of my wound after my procedure, such as with Botox, you cannot lay down for the next 6 hours, you cannot work out, you cannot drink alcohol the same day of the procedure. There are a lot of things that the patient needs to be educated on so that their procedure and outcome is expected. Without words to describe this area of nursing. So I obviously have a couple pictures of injectables, Botox in the top, filler at the middle, and then up in the corner is actually like a balancing thing that I was trying to get. It is about facial balancing, and then also the aesthetic nurse's day-to-day life is a little bit more balanced, usually a 9 to 5. Before and after pictures at the bottom, and then the obvious facial muscle anatomy in that picture. My future timeline is in reach, so I will graduate in May. Immediately after, I will be taking, once I receive my license, I will be taking a cadaver course, which is going to be a 2-day cadaver course before I practice with product on models. I am planning, I'm already hired at my office as soon as I get my license as an aesthetic nurse injector. So for about 2 years after that, I will be continuing my education with predominantly Allergan, which is the company that owns Botox and Juvederm, on new techniques, new ways of assessing patients, and just learning different products and different techniques, because the aesthetic world is always evolving.